Video 71, Grant Writing Basics Area 7, MCHES Subcompetencies 7.1.3. Review the learning objectives for this video. Grant writing is a critical Master Certified Health Education Specialist competency, and I am excited to walk you through this because it is one of those skills that can truly transform your career and the programs you lead. External funding often determines whether programs can launch or expand, so understanding this process gives you real power to make a difference. The process begins with identifying appropriate funding sources, including federal agencies like the Centers for Disease Control and Prevention, state health departments, private foundations, or corporate sponsors. The key is to match your program concept with a funder whose priorities align with your goals. Next, thoroughly review the request for proposals, commonly called the RFP. This document describes what the funder wants, who is eligible, and what the application must include. Read the RFP multiple times and highlight every requirement because missing even one element can result in disqualification. Step 3 is submitting a letter of intent if required. A letter of intent is a 1 to 3 page summary that funders use to screen applicants before inviting full proposals. Step 4 is drafting the full proposal following the funder formatting guidelines precisely, including page limits and font requirements. Step 5 is building in time for internal review before submitting at least 24 hours before the deadline to avoid technical problems. Step 6 applies if a funder invites you to revise and resubmit based on reviewer feedback, which is actually a positive outcome that means your proposal showed real promise. So remember, grant writing is a sequential process, and skipping any step can undermine your chances of success. You are learning a skill here that many professionals wish they had mastered sooner. Most grant proposals require these key components, and understanding each one is going to give you a real edge both on the exam and when you sit down to write your first proposal. The executive summary is a one-page overview stating the problem, proposed solution, target population, expected outcomes, and funding requested. It appears first but is usually written last because it summarizes everything else. The needs statement makes a data-driven case for why the program is necessary using epidemiological data and local health statistics. Here is a helpful tip for you. Instead of writing that many people have diabetes, you would cite the specific prevalence rate from county health data and compare it to state benchmarks. That specificity is what makes a needs statement compelling. Goals and objectives translate the need into measurable, smart targets that connect logically to the needs statement. The methods section is your implementation plan describing what you will do, when, and who is responsible. The evaluation plan describes how you will measure success through both process evaluation, which tracks implementation fidelity, and outcome evaluation, which measures whether objectives were achieved. Finally, the budget and justification must align with the methods section, so every activity has corresponding costs. So here's the big picture I want you to see. A strong proposal tells a coherent story from the problem to the solution to the measurement of success. When you think of it as storytelling with data, it becomes much more approachable. Let us close with strategies that will help you make your proposals truly competitive, because knowing these details can make all the difference. First, follow the RFP instructions exactly. Any deviation in formatting, font size, or page limits can result in disqualification before review even begins. Second, use local data whenever possible. County-level statistics and community needs assessments show reviewers you understand the specific population you plan to serve. National data alone is not sufficient. Third, Demonstrate organizational capacity by describing relevant experience, staff qualifications, and past program successes. Reviewers want to know your organization can carry out the proposed work. Fourth, include letters of support from community partners that commit specific resources. A letter that simply says, "We support this program," is weaker than one that commits meeting space, volunteer hours, or referral pathways. Fifth, address sustainability by describing how the program will continue after the funding period through alternative revenue or policy integration. On the exam, remember that grant writing brings together community assessment, financial management, program planning, and evaluation, making it one of the best examples of how the areas of responsibility connect in practice. I want you to appreciate how much ground you have covered in this lesson. Grant writing is where so many of your skills come together, and you should feel proud of the knowledge you are building. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. The correct answer is B. Grant proposals are strengthened by local data that demonstrates community-specific need. County health departments and school districts typically maintain data on childhood health indicators that can be obtained quickly. Option A relies solely on national data, which does not demonstrate knowledge of the specific community. Option C is unnecessarily extreme and would miss the funding deadline. Option D uses data from a different community, which undermines the proposal's credibility and may not accurately reflect the target community situation. Summarize the key takeaways before